Good afternoon, everyone. This is Tanya Williams in the Office of Early Childhood. We're going to get started with our April provider call. I want to welcome everyone to the call today. And Melinda, you may be getting an answer, but I've asked a specialist or one of our licensing experts to hop on, and there are less experts maybe than in the past. That's probably why nobody knew the answer to that question, but there is a reason. So I thank you for that question, and we're going to have somebody pop that into the chat box pretty quickly. I'm going to let everyone in that I'm seeing in the window. So I'm trying to do both things, but I think I'm first on the agenda. So we'll give folks just a minute or two to get on the call, and then we'll get started.
So they got which college job at?
School, this is Mary Beth.
I think Casey. Oh, you heard her.
But as I usually am trying to mute everyone, I assure you, you do not want everyone hearing your conversations. So please make sure you're muted when you enter the call into the Zoom channel. We don't want to hear everything, and you probably don't want us to. So I just want to make sure. I'm going to start the recording. I know there may be others recording, but just want to make sure everyone's aware that we do record this call for purposes of providers who are not able to get on. And I heard a few conversations as we were joining. I do want to remind folks that this Zoom channel has a limitation, I think, of 300. I'm allowing everyone in today, but if we get up to the 300, those who are staff in the Office of Early Childhood who are not presenting, and any contractors that we work with, I would ask that you would remove yourself. This is really for providers. Right now, that does not seem to be a problem, but that is the reason. We're really reserving this for our early care and education professionals. So that is the only reason we do that. But right now, it doesn't look like there's going to be a problem. We have people continuing to join, but that's why it's to allow our early care and education professionals on this call and to get the information that's going to be shared. I am going to, without further ado, get started so that we can keep moving along. And I'm going to ask, I'm probably going to make somebody a co-host to allow people in as I'm talking. So let me find one of my staff and I'll do that right quick, gang. All right, so Keeler and any of you in the Office of Early Childhood, if you will continue to let our professionals in the Zoom call. And I thank you for that. I'm gonna get us started. I have a LEARNS update. You know, it seems pretty unreal that it was probably roughly a year ago that the LEARNS Act was being passed in the legislature that had significant implications for education in Arkansas, some real exciting things, but also created an opportunity for the Office of Early Childhood to be created and move the former Division of Child Care and Early Childhood Education programs over into this new Office of Early Childhood, as well as including ABC. There have been additional changes since then. As many of you know, our child nutrition program is housed in another part of the Department of Ed, which makes sense if you think about it. It's with our school nutrition program. So Pam Burton and that team are working under Dr. Eric Saunders, who heads up school nutrition. I'm going to keep muting people. I'm asking that you try to mute yourself when you get on, but we can hear you. And it can be distracting for those who are trying to listen in. So the Part B and Part C folks are under Matt Sewell at the Department of Ed, and he is over federal programs and special ed. And we all work together, whether it's child nutrition or Part B and Part C. But we have the Office of Early Childhood stood up. It moved, you know, all around 200 employees overall under the Department of Ed. We moved all of the grant funding that we had at the former Division of Child Care over to the Department of Ed. And all of that's happened in the past several months. I think most of it was done by October 1. There may have been one grant that was a little bit after that, but so all of the grant funding has been moved. All of the employees have been moved. Gonna keep muting. Someone on my team muted everyone. Thank you, whoever did that. I'll try to unmute myself more quickly. All funding's been transferred, the employees, the IT systems, and that is a really big change, guys. And that's a big, hard thing to do. It's a big lift to have IT systems that are on different state agency servers moved over. So many things have happened in that time period. In addition to all of that, we have funded 12 local leads that are a part of the LEARNS Act. And those 12 local leads, and I know a few of the folks may be on this call today, but they are covering about 33 counties across the state. And they've been working on a number of things and are starting on some needs assessment work, but really engaging the early childhood world in their respective communities and the business and industry members in their community to really think about how early childhood could look, what is needed in their respective communities. They've done a child count and submitted that, an engagement plan, and we'll be working on needs assessment and a bigger strategic plan over the coming months. We also have the second cohort request for proposals out there. And for any of you who are interested, it has been out for a couple of weeks, and I think that somebody can pop the closing dates, but we'll be announcing in early May. I think they're due back at the end of April, and we will be funding our second cohort. Just reminder that these are going to be across the state over a period of time, but this second cohort might get us to full coverage, or we may be doing a third cohort, but we'll keep you updated on this provider call. Just ask you to keep paying attention to that. These entities are going to be reaching out to you respectfully in your communities when they're funded. So if you haven't had one funded in your area yet, you may not have had that call, but once your area is funded with a local lead entity, again, it's part of the LEARNS Act. And it is a requirement for programs who receive public funds. So anyone that receives state-funded pre-K Arkansas Better Chance, Child Care Development Block Grant funds, Medicaid funding, Head Start, anyone who receives any federal or state funding is required to participate in this local leads work. And they'll reach out to you, and really it's just to engage and to make sure that we're working together with the state and local entities to meet the needs of that community. So it's a wonderful opportunity for you all to have input into a plan for your, again, respective communities. So second cohort is out, and we'll be announcing those in May. We've had a lot of programs move from levels 1, 2, 3 up to 4 through 6. If you haven't looked at that in a while, it's just really exciting data. And I know if Kelly Hilburn is on, she can pop the latest data into the chat box. It is exciting every week to see programs moving up and leveling up to those higher levels of quality. So really proud of all of you for the work that you're doing. Many of you maybe are participating for the first time. Some of you have moved into level 3 through 6, and the funding really starts to get pretty significant. For those of you who aren't aware, we actually pay through the Child Care Assistance funding a higher amount than our pre-K program pays. And you may not have known that, but it is a higher reimbursement amount. And Lori and I have been talking about that for the past year or so, and how important that is for our pre-K programs to be able to access the funds that they need to be high quality. But just want to acknowledge all of you who have done those leveling up, as we call it here in the Office of Early Childhood. Last but not least, earlier in the year, we received a waiver approval from the Office of Child Care Federal Partners that allows us to serve early childhood professionals who work in a program who serves children on our Child Care Assistance or Child Care Voucher program. So our federal Child Care Assistance Program, CCDF as some call it, allows now for any of our early childhood professionals, so anyone who's working in our early childhood programs, that serves children who are eligible for that. So you have to be a participating child care development program or CCDF program or voucher program, as some call it. And your child has to be age eligible and attending either the program that you work in, or it could be another program that takes childcare that's approved to take the childcare assistance. And let me just sort of underscore here, because I have had a few questions and I understand that, there are people who don't understand that. I've had some outreach even from K-12 teachers. This effort was, as many of you know, one item in the LEARNS Act was to give an increase to public school teachers, K-12 teachers. Some teachers who were in early childhood may have benefited from that if they're working in a district, but many of the people in our field did not receive that benefit. And this was a way to help recognize the early childhood professionals. It's also a way to help you all with retention of your employees. I've heard a lot about the workforce over the past couple of years since the pandemic and even before. So we wanted to acknowledge the work of the people in the early childhood world. If you are not a program that takes the child care assistance, but would like to support your employees, we have staff who are ready to help you with that, and just want to encourage you to do it. It really is a benefit for your program. And you may only be serving the employees that you have, but it could help them and offset and give them essentially a raise if you think about it that way. I see the note, Steph, about an employee who is denied. I'll do a check on that, and I see Teresa Cooper is on that team. If you can send her an email, she will help you with that. We definitely want to follow up on that. So thank you for making that note. And I think that's all the updates we're working on, just so you have a sense of what we're doing currently. We are working on the Child Care Development Block Grant. We are required on a federal timeline to submit that block grant plan by June 30th. And so we're working in partnership with our colleagues at the Department of Ed and State Board. We will have a public hearing on April 30th. That is on our website. You can go out there and look at it. There are options to submit comments via an email, or you can attend in person that day at the Department of Ed. And we look forward to hearing from you about the child care block grant. But it is required to be into the federal government on June 30th. And then we have 7 rules that were formally associated with the Division of Child Care and the Arkansas Better Chance program that are moving through the promulgation or rulemaking process. And so we'll be taking those to State Board in the coming weeks so that they can, take a look at those, ask questions, get those approved by our board, and then take those out for public comment and before the respective legislative committees. So just wanted you to be aware of that. I wouldn't say there are major substantive changes because of timelines. We're trying to get things, done quickly and get the names changed from DHS to Department of Ed, but just want you to be aware. And I do know there will be rules that will need to be revised, as there are other items in the LEARNS Act that require piloting, and we'll have to wait until we get through that piloting. But I want to stop there because there's a lot, but just wanted to let you have a sense of some of the things that have been going on. That is just a snapshot. It certainly doesn't represent everything. And I will say, I know that it doesn't represent some of the challenges that you all have had. And I want to just speak specifically to payments. I know it has been a big change from being at the Department of Human Services and having an automated payment system. When we moved to the department, we had some changes with that, and it has slowed that down just a little bit. We are working to get the automation reinstated. I think it's improved from maybe August, September, so I think it has gotten better, but there have been some hiccups. And I know that our finance folks at AD are very committed to helping us help you receive your payments more timely. And I just wanted to let you know that we are working. They have hired a new staff person who just started about a week ago or 2 weeks ago, and I think over the coming weeks, we will continue to work on improving that payment. And it may not be exactly the way it was, but it may get closer to what it was before, and your payments will be a little more timely. I believe the agreement allows up to 14 days, but I do know that historically we've been able to pay you much more quickly than that. So I'm going to stop there. I know that we have some guest speakers. I think Kayla Bodie is going to be talking about background checks. But before I do that, because we're just going to keep moving, Kayla, when you finish, we're going to let our incredible colleague, Gwen Williams, talk about her early childhood work after Kayla does the background check. So, Gwen, thank you so much for being available today. And I can't wait to hear about what you've been doing in your program after Kayla talks to us about background checks. Kayla, can you unmute? Uh-oh. Can someone help Kayla unmute? Sorry about that. Oops, Kayla, you're muted again. I'm not sure what's happening. If you need to come down to my office, you're welcome to do that if we can't get your technical difficulty corrected.
Okay, type, is it unmuted? It looks like she's unmuted now. I don't,
It does, but I don't hear her talking.
okay.
I'm gonna try it again, Kayla.
Kayla has posted that she cannot unmute.
All right, Kayla, if you want to walk down to my area, you're welcome to take my mic. I'm gonna go on mute for a minute, folks, while Kayla comes down.
I think I'm here. Can you hear me?
Yes.
Okay, so sorry about that. Good afternoon, everyone. I will keep it short and sweet. Sorry about the technical difficulties. So as you heard Tanya say, we are in the middle of moving some things with background checks, and this is kind of just a pre-warning of a few changes. So nothing has happened just yet, and you won't need to do anything on your end as a provider. So no changes need to be made in your process or your procedure for running background checks. We just want you to be aware of a few minor changes. Right now, when you're submitting your background check and you are completing your consent form and you're submitting that applicant into your online portal, you are seeing a transaction ID that starts with the prefix of CHI, and then it says childcare out next to it. So we are just changing that. You're going to now start seeing it as ECE for early childhood education. And so you're going to see that on your consent forms, and you're also going to see that in your INA account when you're submitting new applicants. This is going to be an automatic change. You will not need to do anything. You don't need to make any changes. Our IT partners are going to make the switch after hours within the next couple of weeks. And so you will just see that happen. But we knew that there would be questions because that is going to look it's going to be new. It's going to look a little different, but not to worry. You won't need to make any changes. It will not affect your background check process at all. And for those of our providers that are on a school district campus, you won't change anything about the way you do those as well. You will just see that new option that says ECE for early childhood education. And so I don't have anything else about that. If you have any questions, feel free to put them in the chat, and I'm going to put my contact information for everyone. So if you have any questions or you have any issues, feel free to give me a call or send me an email. And if anyone needs anything with background checks, please reach out. And now I believe Miss Tanya said we are going to go over to Miss Gwen Williams and hear about her wonderful program.
Good afternoon. Are you able to hear me?
We can, Miss Gwen.
Yay, great. Listen, thank you for providing me with this opportunity to speak with you briefly today. I was grateful to be asked. A little background on us. We opened September the 4th, 1984. And I have been the director since August 1987. We are licensed for 102 children. Right now, we have a current enrollment of about 70. 75% of our children do participate in the voucher program. And we were blessed enough to receive 3 grants. One, of course, was during the COVID period. And we used that to purchase the sanitizing and disinfecting products. We did the thermometers. We hired additional staff to make us ready for the influx of people coming in. And we removed all the carpet from our center. We replaced it with vinyl wood floor. Vinyl wood floor. I don't know if that's possible. Okay, but we purchased classroom furnishings. We chose the ones that were easy to maintain, to maintain, durable, and that we could easily sanitize and keep them clean. We replaced our playground fence. We enlarged our play area. We added more playground equipment. We did, our playground did not have shade, so we were able to purchase shade, those little shade coverings. And what the grant funding did for us, it allowed us the opportunity to lower our ratio. And in lowering our ratio, we became better at what we do. I think I was most excited because we were able to participate in great training. Now, listen, we're located in Southwest Arkansas. So you have to go through Texas to get to us. That's how far down. So for us to get that good, solid training, we had to travel. Grant money made that possible. We were able to do Jonesboro, Little Rock, El Dorado. The whole staff was able to go. That gave them an opportunity to network. They had an opportunity to listen to other women who do what we do every day. And they found that we're not in this thing by ourselves. They became empowered. Their confidence level soared. As a director, I was most happy to see them actually implementing their training. The grant funding allowed us to do overnight stay, so that we were and to pay for substitutes so that more people could attend. We have them now with 3 who have completed their CDA. We have teachers that are working toward their associate in early childhood. Again, this is the grant money that we're still using for subs. And we took $10,000 and did a parking area. We never had a concrete parking space for our teachers. That sounds like a small thing, but to be able to put their parking spot in front of our building, each teacher had their own place. You know, it's good to know where you belong, and they could drive up to their spot. You know, that was my way of showing, hey, I'm glad you're here. I appreciate you. You are in the right spot. And they would walk in, and they just became better teachers. We poured into them because of training that they were able to receive. They, in turn, poured into our children. We were able to watch our children just thrive. They were happy. They were happy. They were learning. The whole atmosphere of our center changed. What it did was it really increased our level of quality care across the board. We went as far as updating their lounge area, giving them a space. We We equipped it with more comfortable seating, a bigger work area, more curriculum material, lending libraries. The things that we got in training, we bought duplicates back if we had them, and we would put them in there for everyone to use. We were really big. We did one training on filling your cup, and that they just kind of fed in on that one, and they became very big on finding the plus and the positive in their coworkers. So I think a happy teacher made just a whole happy environment. And with our lounge area, we did a coffee bar, we did a juice bar, we even did a water bar with those little powdered drinks and healthy snacks. And what it did was, instead of our teachers leaving for lunch, we end up with 95% of our teachers here during our lunch period, during nap time. So we stay always over ratio, and that hardly ever happens. So that was a good thing. We found that better trained teachers, they begin to know their worth. They knew that they were appreciated. They became better teachers. Our kids were happier. Our waiting list increased. And my wonderful licensed specialist, Terry Grice, was always available to help us find new training, or made herself available to train us. I'm just going to say what I thought I would never be able to say, and that was that our teacher turnover rate has leveled out. You know, it without the grant, and I feel an ugly cry coming, but without the grant, there is no way that our doors could have stayed open without that funding. We were able to become better than I ever dreamed. And as a director, it just made my heart happy. Our kids are just great. And after COVID, when they came back to us, some of them had not been in a child care setting for a while. So we had to deal with delayed language, aggression, social skills that were lacking. But because of the training that they had received, they were able and they were equipped to handle this. And they didn't become overwhelmed. I can't say enough. We're just grateful. We're grateful for every grant. And when I say that I mean I'm grateful as a director. Our parents are grateful because of the impact that it has had on their children. Our teachers are grateful because they know their worth and they act in their worth. Our community, Ashdown, is grateful because we're still in business. So, in summary, I just wanted to say that our grant funding helped with the mental health of our teachers. It helped with their professional development. It allowed our center to operate more effectively. It allowed us to have confidence to be what we were meant to be, and that is educators and they're providers. We became better teachers and more loving care providers. I could go on, but I'm just going to say amen. And we were grateful. And thank you for allowing me this opportunity.
Miss Gwen, thank you so much for your incredible service that you've provided in a really small community over a very long period of time, and for your thoughtfulness and leadership in thinking about how to utilize these resources in a way that will benefit not just the children you serve now, but into the future. So just an incredible story. And I saw lots of comments in the chat box, so make sure you see them and share those with your employees and your program. It really is exciting to hear that, as I know there are many challenges in parts of the state, and it's great to hear from someone who has that kind of longevity and has been able to take things and make the very best of a challenging situation over the past couple of years. So we thank you for giving us your time today. I have seen a few notes in there, and I just want to go back. There's several notes about the vouchers, and I think I said something this morning to a colleague that's on the phone that we're going to stop calling our childcare assistance vouchers, because it really is starting to get complicated out in the universe when the Department of Ed and the LEARNS Act has something about vouchers for EFA accounts, and they are completely different, gang. That is a state program with state funding for K-12 and programs that serve those students. Ours is a federal child care program that has very strict, pretty specific criteria around the eligible families that we can serve and how we can utilize those funds. So they're very different things. I appreciate the comments. I will, or maybe somebody from the Department of Ed. Daryl Smith is my colleague over at ADE, and if I can get Daryl's contact information, if somebody has questions about those EFA accounts, I can, refer you to Daryl for those funds. It's very, very separate funding things. So there's certainly some places where it may align a little bit. Families can choose, they can apply for our child care assistance and select a program that participates in the child care assistance program, but not all of our programs are required to do that. And we don't make programs do that. We encourage it. But anyway, they're very different. So I do appreciate all the comments about the EFA vouchers and our child care assistance. So, but they are separate. And I noticed Patricia, and thanks Lee Keener, who's a member of state board and really our early childhood representative. Thank you so much for being on. Lee put in the chat box a link to our child care development block grant draft. And so thank you for doing that. And also just want to thank the staff who are dropping in their email addresses to help. I noticed a comment about billing issues or concerns. I did talk a little bit about payment. The way payments are processing is significantly different. I've talked about this before, so it's on a previously recorded call, but if you are a child care assistance provider, meaning you get our federal child care block grant funds for children who are eligible, the children who are foster care or protective services that are approved by the Division of Children and Family Services at DHS, so mostly foster care children, those are paying out automated. So you may get, if you have a foster child authorized for childcare, you'll get your payment. You'll bill and you'll get your payment just like you did when the Office of Early Childhood was at the Department of Human Services. Everything else is processing a little bit differently. And so I understand that for the essential childcare or childcare assistance that we had with American Rescue Plan Act that ended last week, March 31st. That funding was being drawn down in small amounts. And so some of you may not have been paid for a couple of weeks for that. I think Laura our finance person was working with the Department of Ed to make sure all of that gets processed through. But your regular low-income childcare, your regular low-income childcare assistance, if you're billing, you should be getting paid routinely for that. But I think those that were under that essential, that we just had a little bit of funding left and we were running it through March 31st. There may be a little lag time with that. And it was a small group. So it probably is not a lot of money, but if you're paying attention to your reconciliation and looking at what you've billed and then what you've been paid for, it doesn't match up the way it did 3 years ago or 2 years ago. You would get usually one payment for childcare assistance. And now you're getting sometimes multiple payments. You're getting foster care and one little lump sum, and then you're getting low income childcare. And I think the essential childcare, and that will end, you will bill out through March 31st and that funding is done. We are completely finished with that funding. So I know it's kind of complicated, but we are working on getting the automation portion of that back in place at the Department of Ed. They just wanted to have a better understanding and deeper understanding of how the funds work. And I understand that finance people want to have control over things and they want to make sure we were doing things properly. But I think we have an automated process and we're just trying to reinstate that. And hopefully that will help with your payments and the timing. And we may have somebody from finance on our next call to kind of walk you through that if there are any questions. But just know if there are billing issues, Patricia Johnson has put her email in. If you're having any difficulty with that, please let her know that. And I think that's all the questions. Staff are continually putting things in. I think Kayla has reached out to a few of you who are asking about background checks. And we will keep you apprised as we move into the new ORI number from the current CHI to the early childhood education one that is coming. But we'll keep you posted. And I assure you, when you start running background checks and there's no CHI to choose from, you're going to know we have moved. But we'll have that announcement on our website. And Kayla's team will make sure that you have that information because it may happen between now and our next call in May. I'm gonna go, I think our next call, I'm gonna check the date, is May 7th at 12 p.m. Again, thank you all. Thank you for being patient this year as we've all handled a huge transition and lots of change. I will tell you that working here in the Office of Early Childhood, for those of you who don't know, we're still sitting at DHS. And I know the workforce issues that you're experiencing are equally here within our office. We equally have had chances or opportunities for our employees to move into other jobs. And so we see a lot of switching and a lot of change. And so I know it's hard, but it was really heartfelt to hear Gwen talk about her stabilizing, and that gives me such hope for everyone else, because I know in these rural communities, it is sometimes harder to stabilize that than in other places. So hats off to her. And I know we have some other guest speakers scheduled for the May call. If there's anybody on today that hasn't talked and would like to, please email me or any of the staff's emails that are on here and let us know, and we'll get you in on the next call. And just appreciate all that you're doing to elevate children's learning and help them prepare for life and education as well as life success. So thank you all, and we'll see you in May.